Good afternoon, everyone, and thanks very much for attending our webinar sponsored by the WA Group. The name of our webinar today is Getting Ready for Medicare and What You Need to Know. My name is Kerry Colpitz, and I'm a WA Group employee. I work out of the Woodbury office, and I thank you for attending our webinar today about Medicare. I think it's probably going to be pretty important to the most people that are attending. So again, thanks very much. We do have quite a number of people that have signed up for the webinar, so I will not be able to get to everyone's questions during the webinar, but at the bottom of your Zoom screen, there is an area where you can indicate your questions, and please go ahead and ask any questions that you might have. I'd be more than happy to respond to those questions after our webinar is over. And at the end of the webinar, I will have my contact information with my email address and my telephone number, so that if people have more specific questions that they want to talk to me about or can't really explain it in a question on a website, please don't hesitate to reach out to me. Be more than happy to help you. So let's go ahead and get started today. So when you're 64, there's a lot of things that you need to be considering, such as Social Security, retirement, your physical and financial health, and also Medicare. And even if you're going to continue to work, these are items that you should be aware of to see how they're going to affect you. So what is Medicare and why are we here today? Well, let's just talk a little bit about what is Medicare. Medicare is a federal program that provides basic affordable healthcare coverage for beneficiaries. Most people become Medicare eligible at age 65, but some people, because they're permanently disabled or they're diagnosed with end-stage renal disease. And you become Medicare eligible if you or your spouse has worked a total of 40 quarters and have qualified to make minimum contributions into Medicare. Also, people who are eligible for Medicare cannot be denied coverage due to pre-existing conditions or canceled if you get sick. And as I said, Medicare is a federal program administered by CMS, or the Centers for Medicare and Medicaid Services. Medicare has been around since 1965 and was signed into law by Lyndon Johnson. And little trivia, former President Harry S. Truman was the very first Medicare recipient. So what is Medicare and what are the ABCs and Ds of Medicare? Well, let me explain these different components. Part A and Part B, also referred to as Original Medicare, again, are provided by the federal government. Again, you've paid into Medicare. If you've done that, you are eligible for Part A and can enroll in Part B. There's also a Medicare Part C, and those are Medicare Advantage plans. Those are the commercials you see on TV with Jimmy Walker and Joe Namath talking about Medicare Advantage plans. And Medicare Part C plans are sold by private insurance companies. There's also a Medicare Part D, and the D stands for drug coverage. Prescription drug plans are offered as an optional benefit, sometimes as a standalone or as a bundled benefit under other types of plans. And I'll talk a little bit about those. But first of all, what is Part A of coverage? What is Medicare Part A? Is hospital coverage. Basically, it's inpatient hospital stays, it's skilled nursing facility stays, it's hospice, it's home care. And again, if you've qualified for Medicare, Part A of Medicare comes to you at no cost. But Part A of Medicare doesn't cover all of your hospital costs. In 2023, Part A does have a $1,600 deductible for every time you utilize Part A services. You end up paying a $1,600 deductible for each inpatient hospital stay. Now, what is Medicare coverage or medical Part B coverage? Well, again, Medicare Part B is typically physician coverage. Part A is hospital coverage. Part B is physician coverage. So it covers doctors and other medical providers, covers outpatient care, durable medical equipment, and home health care. But like Part A, Part B does not cover everything. In 2023, Part B has a $226 deductible per year. Also, Part B only covers your services at 80%. So if you have give you an example. Say you have bypass surgery and you're in the hospital and it's $100,000 bill. Well, it's divided between Part A and Part B. So Part A of the hospital bill, so $50,000 of Part A coverage would be covered less a $1,600 deductible. But Part B, which would cover your cardiologist, your surgeon, your anesthesiologist, you're responsible for 20% of that. So if the bill is $50,000 from those providers, you're out of pocket under Part B is 20% or $10,000. So again, Medicare A and B do not cover everything. Also, there is a Medicare Part B premium. As I said, Medicare Part A is at no cost, but for Part B coverage, there is a premium for each participant. And here is the 2023 costs for Part B coverage. 2024 costs typically are released in late October to early November. So we're looking at 2023 costs. We anticipate 2024 costs to increase because of cost of living. We don't know what those numbers are yet, but they will be forthcoming. Now, Medicare Part B premiums are based on income. And if you're married, filing jointly, making less than $194,000, you and your spouse would each pay $164.90 for your Part B of Medicare. If you're making more than $194,000, or if you're single, you may be paying more for your Medicare Part B premium. Also, Medicare adjusts these dollar amounts annually, and they do a 2-year look back. So these numbers for 2023 are actually based on 2021 income. So in 2024, Medicare Part B premiums will be based on individuals' 2022 income, and it adjusts on an annual basis. So what is original Medicare? And as I said, it doesn't cover everything. Well, as I said, there's many out-of-pocket costs under Part A and Part B of Medicare that fall to your responsibility. As I said, both have a deductible, $1,600 for Part A, $226 for Part B. Part B also has a co-insurance amount of 20%, so you would be responsible for 20% of any physician services. But some of the big items are that most outpatient prescription drugs are not covered under original Medicare A and B. Inpatient hospital and skilled nursing care charges above the Medicare limits are not covered. Items such as eyeglasses, contact lenses, hearing, and routine dental services also are not covered under original Medicare. Most healthcare services outside the United States are not covered, and there is no annual or lifetime limit on what you can pay out of pocket. So again, every time you utilize Medicare A and B, there's a deductible under A and B, and there's co-insurance under B. There is no maximum out of pocket for you on that. So now, what is the Part C component? Well, Medicare Advantage plans, these are the commercials you're seeing on TV with Jimmy Walker and Joe Namath. They're the ones that are talking to you or trying to persuade you to enroll in a Medicare Part C policy. Basically, when you choose to enroll in a Medicare Part C policy, you are assigning your Medicare benefits to that insurance company, and then that insurance company becomes your Medicare plan. So no matter who you pick for your Medicare Advantage, for your Medicare Part C plan, they become your insurance company for your Medicare benefits. Now, what is a Medicare Advantage plan? Well, as I said, Medicare Part C or a Medicare Advantage plan actually replaces your Part A and B of Medicare. But it also often includes prescription drug coverage, such as coverage that you would normally buy as a standalone policy if you had Medicare A and B alone. It's also most of the time included in a Medicare Advantage plan. You may pay a monthly premium for this, and you also would continue to pay your Part B premium. So on the previous slide where the Medicare Part B premium for most people is $164.90, you would continue to pay that $164.90 for your Medicare Part B premium. But with Medicare Advantage plans, you cannot be turned away. If you're Medicare eligible, the Medicare Advantage plan has to accept you. And what I really like about Medicare Advantage plans is that they offer additional benefits that Medicare does not cover, such as vision, eyeglasses, contact lenses, dental services, hearing aids, enhanced preventive care. A lot of items that original A and B of Medicare do not cover, Medicare Advantage plans do cover that. Also, you might see those commercials on TV where they're talking about Medicare Advantage plans that have a $0 premium. The idea behind it is, well, how can an insurance company sell me a policy that has a $0 premium? And how a Medicare Advantage plan works is, as I said, when you enroll in a Medicare Advantage plan, you're assigning your Medicare benefits to that insurance company. Now, people who are getting close to age 65 or might already be 65 years old have been paying into Medicare, some for 40 to 45 years. They've been paying into Medicare because every time they get a paycheck, a little bit comes out of their paycheck and goes to Medicare. And Medicare has got a big bucket of your money over the last 40, 45 years. And Medicare is holding that bucket and they're saying, okay, when you become Medicare eligible, we'll pay part of your hospital bill and we'll pay part of your doctor bills, but we're not going to pay all of it. But when you enroll in a Medicare Advantage plan, Medicare basically is assigning that bucket of money to the insurance company that you choose. And Medicare then pays that insurance company every single month for you. Basically, they're reinsuring you with that insurance company. And in most parts of, I'm from the Minneapolis-St. Paul area, most counties in my area, insurance companies get in excess of $900 per month from Medicare when people enroll. That's why you see those TV commercials. That's why you're getting bombarded at home with all this mail, because the insurance companies are trying to increase their membership because they're going to get paid directly from Medicare. They might also ask for a premium from you, but the lion's share of the income that insurance companies get for providing Medicare Advantage plans come directly from Medicare. Now, Part D of Medicare, what is that? Well, Part D covers prescription drug coverage. And this is also, like Medicare Advantage plans, this is also sold by insurance companies. This is not provided by the federal government, it's provided by insurance companies. Now, Part D prescription drug coverage, again, it's a private plan that helps pay the cost of prescriptions on the plan's formulary. There's always a monthly premium for a Medicare Part D policy. And what people need to realize is that although Part D prescription drug coverage is optional, you do not have to buy it. If you do not buy it when you are very first eligible, and you do not have any other coverage that meets the minimum threshold that Medicare requires you to have, you could be paying a penalty for not enrolling in prescription drug coverage or not having prescription drug coverage that meets that threshold starting when you become Medicare eligible for the first time. And you can only leave or change plans at certain times of the year for Part D. Now, as I said, Part D prescription drug coverage, there is a monthly premium to that. And in 2024, the expected average national cost of standalone Part D coverage is going to be about $55 a month. And that's coming right from the Centers for Medicare and Medicaid Services. Now, although we talked about having Part A and Part B of Medicare, with the significant exposure that people are potentially incurring under having just Part A and Part B of Medicare, typically what people do is they buy something to go along with their original Part A and Part B of Medicare. A couple of those options include Medigap or Medicare Supplement Plan. They're the same thing, or a Medicare Cost Plan. Now, what is a Medicare Gap Plan or Medicare Supplement Plan? Well, it's exactly what it sounds like. A Medicare supplement pays the gaps that Medicare A and B leave as your responsibility. So under Part A of Medicare, as I said, there's a $1,600 deductible. Part B of Medicare only covers services at 80%. Well, a Medigap or a Medicare supplement plan would pay that $1,600. It would pay that 20% coinsurance. So you can have original Medicare Parts A and B and then purchase a Medigap plan from an insurance company. Now, Medigap plans do not cover anything that Medicare A or B didn't pay a portion of. So, as I said, Medicare A and B don't pay for medications, they don't pay for dental, they don't pay for hearing aids. So a Medigap or a Medicare supplement plan cannot pay those services. Also, Medigap or Medicare supplement plans may require underwriting if you do not enroll in a timely basis. So when you become Medicare eligible for the very first time, you can buy a Medicare supplement or a Medicare gap plan, and you cannot be turned down when you first become Medicare eligible. But you only have a window in which to enroll. Once that window closes, you can enroll in a Medicare supplement or Medicare gap plan later on, but the insurance company may require health history underwriting or health history screening, and you may have to be approved. Otherwise, they could deny you coverage under a Medicare gap or a Medicare supplement plan. That's a little bit different than a Medicare Advantage plan or a Medicare cost plan that they cannot deny you, but a Medicare supplement or gap plan can. Also, with a Medicare gap plan, you must have your Part A and Part B coverage in place. You have to continue to pay your Part B premium. And Medigap or Medicare supplement plans are not regulated by Medicare. They're regulated by the state in which you live in at the time you purchased the plan. Now, you have the ability to see anyone who accepts Medicare, and your Medicare supplement or your Medicare gap plan will pay the balance. They will pay that $1,600 or will pay that 20%. Also, you have the ability, once you've purchased a Medicare gap plan or a Medicare supplement plan, the peace of mind that you'll have with those types of plan is that they're guaranteed renewable. So if you live another 50 years after buying a Medicare supplement or Medicare gap plan, that plan will never change. They can never take that plan away from you. Even if the insurance company stops selling it to new enrollees, they must continue to renew it with you. Also, you have the ability to, leave the state in which it was purchased. So if you bought it, when you were 65 years old in the state of Minnesota, and then you retired to the state of Florida 5 years later, you get to take that plan with you. That is convertible, so you have the ability to keep that for the rest of your life. So there's peace of mind when you buy Medicare gap or Medicare supplement plans. You also have the ability, if you have Part A and Part B of Medicare, to purchase a Medicare cost plan. Now, these plans are not, extremely popular, and they're not utilized a lot because they're typically sold in more rural communities. Medicare cost plans are options when Medicare Advantage plans do not have market penetration with two carriers. So you'll find Medicare cost plans available in fewer places in the country than you would Medicare Advantage or Medicare supplement plans. But Medicare cost plans for people in the right area are really nice because they reduce what your out-of-pocket costs are going to be. They do have maximums on your out-of-pocket limits. And again, you cannot be turned away. If you're a Medicare eligible person, you can buy a Medicare cost plan when you're first eligible, and you can buy it later on too, even if you've had some medical issues. You cannot be turned down. But again, Medicare cost plans are not available in all locations. Again, you need to have Part A enrollment, and you need to continue to pay your Part B premium. As I said, they do have additional benefits such as vision, dental, and hearing services. They can be offered with or without prescription drug coverage, which is really nice benefit because you can buy a Medicare cost plan and your preferred prescription drug plan, even if it's with a different carrier. You can separate them. But again, they're not available in all counties nationwide. As an example, in Minnesota, we have 87 counties in Minnesota. Medicare cost plans are available in only 21 of the 87 counties. So not everyone is going to have the ability to enroll in a Medicare cost plan. And again, it's determined where the county in which you live. Now, as I said, there's the fourth part is Medicare Part D plans, and prescription drug services can be bundled in coverage or purchased as standalone coverage. Well, what's a bundled coverage mean? Well, bundled coverage means is your prescription drug plan is part of your Medicare Advantage plan. So your Medicare C and D combined. Or, as I said before, you can have bundled prescription drug coverage as part of a Medicare cost plan. Also, prescription drug coverage can be bought as a standalone coverage. Medicare provides only prescription drug coverage for these Part D policies, and they can be paired with original Medicare. So you can have just A and B of Medicare and standalone drug coverage, or you can have A and B of Medicare, a supplement plan, and a standalone prescription drug coverage, or you can have A and B of Medicare, a Medicare cost plan, and prescription drug coverage. And if this is confusing for you, I certainly understand that because listening to it for the very first time, it is. So that's why I ask or invite people to ask questions for more clarifications or reach out to me after the presentation. So how does prescription drug benefits work? Well, this is the standard benefit that Medicare has authorized insurance companies to sell. And again, Medicare Part D policies are sold by insurance companies. This is the standard benefit or the minimum benefit allowed by Medicare for insurance companies to sell. And there's three phases of coverage. The initial coverage is that when you first start the plan or you first start medication, you may have a deductible and you would pay that deductible or have co-insurance or co-payments for the initial coverage limit. The coverage gap, phase 2, begins once you and your plan have paid $5,030 in the year. Now, again, these are 2023 numbers that I'm referring to. After you and the plan have paid a total of $5,030, then your coverage is at 75%, and you would be responsible for 25% of the generic or the brand name drugs. Phase 3, which is the catastrophic coverage, this is when your out-of-pocket total reaches $8,000 for the year. Then coverage is covered at 100% thereafter. So once you've incurred that amount of dollars out of pocket, then the rest of the year you are covered at 100%. And again, this is the minimum requirement that Medicare allows. Lots of prescription drug plans provide a richer benefit than this, but they cannot provide a lower benefit level than this. Now, when people become Medicare eligible at age 65 or end-stage renal disease or they're disabled, how do they enroll in Medicare? Well, if you're not already receiving benefits from Social Security or the Railroad Retirement Board, there's 3 different ways that you can enroll. And you need to be proactive. If you're not getting Social Security, you need to be proactive and enroll in Part A and Part B of Medicare. And how do you do that? Well, you can contact Medicare either at 1-800-MEDICARE or go online to www.medicare.gov and enroll in Part A and sign up for Part B of Medicare. And again, if you've worked the minimum number of quarters or your spouse has worked the minimum number of quarters, you cannot be denied Medicare. You also can contact your local Social Security office and they will assist you in enrolling in Medicare. If you're part of the Railroad Retirement Board, you should contact them for more information about signing up. If you're already receiving Social Security benefits or Railroad Retirement Board benefits, you are going to be automatically enrolled in Parts A and Part B of Medicare when you become Medicare eligible. And you become Medicare eligible the first of the month in which you turn 65. So if your birthday is in January 15th, you actually become Medicare eligible the 1st of January. If your birthday is on the 1st of the month, you become eligible for Medicare the 1st of the prior month. So if your birthday is January 1st, you become eligible actually December 1st. So now, how do you enroll and when do you enroll? As I said, you become Medicare eligible the 1st of the month in which you turn 65. So as an example, if someone's birthday was January 15th, they're actually eligible to enroll in Medicare on January 1st. They can, their initial enrollment period is 3 months prior. That means in October, November, or December, they can begin that enrollment process. And it would be effective on the 1st of the month in which they turn 65. But trust me that if you wait until December 31st to enroll by January 1st, it's not going to happen. The federal government's not moving that fast. I would tell everyone to start this process, 60 to 90 days prior to their Medicare expected eligibility date. Otherwise, they're going to be doing stuff on the back end, and it's going to be delayed. Now, again, you have this window in which to enroll in Medicare. And again, if your birthday is in the month of January, you have 3 months prior. You also have the month of January to enroll. If you enroll after your Medicare eligibility date, your eligibility date becomes the 1st of the following month. So if you enroll in January, even though your birthday's in January, you will not be eligible until February 1st. You also can enroll in the 3 months after your birthday. So if your birthday is in January, you can enroll in February, March, or April for an effective date, first of the following month, as late as May 1st would be your effective date. But again, it makes more sense to enroll early than it does waiting and getting pushed up to the wall there. So now, what kind of combinations are available? And that's, we've talked about what Medicare A and B and C and D are. Well, again, the items or the types of coverage you can enroll in is having original Medicare, which again is Part A and Part B, and adding a prescription drug plan. Now, again, this is only going to give you coverage with the $1,600 deductible, the 80% coverage. It's not going to cover anything else other than what we've described here. Also, the prescription drug benefit that is not going to cover anything else other than prescription drug coverage. So be aware of that. Well, how do you enroll in a Part D policy? Well, again, it's a private Medicare approved Part D prescription drug plan. Basically, it's an insurance company that provides Part D coverage. And depending on what county you live in would determine what plans are available in those counties. And all Medicare Part D policies provide creditable coverage, which means the minimum requirement, at least, that Medicare requires you to have to avoid, as I said before, it would avoid any penalties if you had Medicare Part D available to you or enrolled when you become Medicare eligible. Other combinations would be having original A and B of Medicare, having a prescription drug plan for your drug coverage, and a Medigap or Medicare supplement plan. So parts A and B would cover some of your hospital and some of your physician services. The Medicare supplement or GAP plan would cover the balance of those services, but again, nothing more than Medicare A or B paid a portion of. So no dental coverage, no vision coverage, no hearing aids. And then adding a prescription drug plan. So basically, you're having A, B, D, and the Medicare supplement plan as an option for yourself. Now, how do you enroll in a Medicare supplement or Medicare GAP plan? Again, it's basically the same thing as a prescription drug plan. You work with an insurance company to provide that benefit for you. You must continue to pay your Part B premium and the Medicare supplement or the Medicare gap premium as well. Other coverage combinations include Part C, the Medicare Advantage plan. I really like these Medicare Advantage plans. I think they provide a really good bang for your buck in terms of benefits. And you can, on some Medicare Advantage plans, have individual prescription drug coverage. So there's some Medicare Advantage plans that do not have prescription drug coverage, and you can have basically a prescription drug coverage standalone. But this typically only works if you're getting medications from the VA. So most people who buy a Medicare Advantage plan without prescription drug coverage, eventually they're going to be penalized if they do go to buy prescription drug coverage later on because they didn't have prescription drug coverage that met the minimum threshold. Or people buy a Medicare Advantage plan, a Part C plan that includes prescription drug. So that MAPD, that's a Medicare Advantage prescription drug plan. And those are in the country the most popular types of plans that are being sold today. How do you enroll in a Medicare Part C plan? Again, like a standalone Part D plan or a supplement plan, you enroll with a private insurance company. You also must continue to be enrolled in Part A and Part B, and you must continue to pay your Part B premium. Other coverage combinations are original Medicare with prescription drug benefits, or a Medicare cost plan with a prescription drug rider. And again, they are individual health insurance policies that you would enroll with directly from those insurance companies. And again, you would need to continue to pay your Part B premium at all times. So options to consider. And again, even if you're going to continue working past age 65, you need to be aware that there are some requirements for you with Medicare. And I would advise you to talk to myself or another licensed agent who can explain this to you, because there's a lot of moving parts and it is at times confusing. So you need to be aware that if you remain covered under your employer plan or your spouse's plan, you may incur a late enrollment penalty. If the prescription drug benefit doesn't meet the minimum threshold, based on the size of your employer, Medicare could be primary or it could be secondary. You need to be aware that whether it's primary or secondary, because you could be penalized for not enrolling in A and B of Medicare when you were first eligible. And if you do have prescription drug coverage, you can actually buy prescription drug coverage even if you're Medicare eligible, but are going to continue to stay under your employer plan. If your employer plan's prescription drug benefit doesn't meet the minimum threshold to be creditable, you still can enroll in a Part D policy. So having your employer's plan and a separate D policy is actually, you're eligible to do that as well. And as I said, not knowing what your potential Medicare penalties are could be expensive down the road. If you do not enroll in a Medicare Part B plan when you're first eligible and you do not have any other coverage, when you finally do go to enroll in Part B, there is a 10% penalty for the Medicare Part B premium for each year that you didn't enroll. And as I said before, the Medicare Part B premiums for 2023, the minimum was $164.90. So if you go 1 year without enrolling in Part B and don't have any other coverage available to you, when you finally do enroll in Part B, you'll pay the $164.90 and then a $16.49 penalty on top of that. So again, the 10% penalty is for each year that you didn't enroll in a timely basis. So if you wait 5 years, your penalty is a 50% penalty of that $164.90. And as Part B premiums increase, it's still a 10% penalty. So it's still going to be 10% of what the new premium is. Also, there is no number of years that you pay the penalty and then the penalty is waived. So if you wait 1 year, you may pay that, you live another 50 years after that, you will pay that penalty for the next 50 years. So it's not, hey, I only missed 1 year. It's only 1 year penalty. It's a lifetime penalty. So be aware of that. Also, there is a 1% penalty of the national average prescription D premium for non-enrollment. And that 1% penalty is 1% per month. So it's actually a 12% penalty per year. So if you don't enroll in prescription drug coverage or have prescription drug coverage that meets the minimum threshold, it's a 12% penalty per year. And as I said, the average prescription drug plan that CMS is indicating for 2024 is about $55. So that 1% penalty times the number of months that you didn't enroll when you were first eligible could be quite expensive later down the road. So that's the presentation that I have planned for today. This is my contact information with my email address, my telephone number. And there's, again, at the link at the bottom, there's questions and answers that you can ask questions, and I'll be more than happy to respond to each person. I'm going to leave this information up here for a couple of minutes in case you'd like to write down my email address or my telephone number and give me a call. I'd be more than happy to answer your specific questions. Also, everybody who attended this presentation, this webinar today, I'm going to send out a link to this video so that you can, if you have issues and want to go back and check something, you can certainly rewatch it if you want, or just give me a call. I'll be more than happy to share any information with you. So again, everyone, thanks very much for attending. I appreciate it. Everyone have a great day. Thanks.